want to emphasize that I fully recommend and endorse that each and every eligible staff member and resident gets this vaccination. I know this is an unprecedented time, it's an unprecedented illness, and it's an unprecedented vaccine. However, the steps and hoops that this vaccine has had to go through has been thorough, has been non-political, and has been done very well medically through people and organizations that are very trustworthy, and again, fully endorse that each and every staff member and each and every resident here gets this vaccine who are eligible. The way that the vaccine works is through a messenger RNA system. A vaccine that uses the messenger RNA system is unique. However, the use of messenger RNA systems is not unique in medicine. We use it in several other areas of medicine delivery, and so although the vaccination piece of this is somewhat unique, it's not unique in medicine and has been shown to be very safe in other areas. Messenger RNA essentially is a synthetically created messenger RNA that is the same as what the coronavirus carries. It's delivered to the human body and essentially asks the human body it gives them a recipe, gives our cells a recipe to create the antibodies as if we were infected with this virus. So this is not a live virus. This is not an injection of the virus into anybody. It is one piece or a messenger RNA of a synthetically created messenger RNA that tells our cells, gives them the recipe to make the antibodies that would essentially kill the virus if we are indeed exposed to it. Shortly after the delivery of the synthetic messenger RNA, the body kills that synthetically created messenger RNA. So that synthetic piece is not remaining in our body, does not ask our cells to do anything after that first fire is started. So once those antibodies are starting to be created, essentially our body thinks it got exposed to the coronavirus. As you can imagine, when our body thinks it's exposed to something, it starts to create a process of creating the armies to attack it. That process of creating the armies will give our body symptoms. The vaccination itself is 95% effective. What that means in numbers terms is that out of about 20,000 people who were injected with the vaccine, 8 of them actually got COVID. Of those, not from the vaccine, let me say that, they got it down the road. So you don't get COVID from this vaccine, it's not a live vaccine, but they ended up getting COVID. So that's 8 out of 20,000. One of those 8 required hospitalizations. So therefore, extremely safe, and also has maybe some protective effects from those 5% that don't get covered to keep them from getting a more severe infection. That's 95% effective after the second shot. After the first shot, it's 52% effective. So we are strongly encouraging anybody who gets that first shot, even if they get sore and feverish and fatigued, to get that second shot, because the first shot is really only 52% effective. The symptoms will usually be very, very mild. And one of the other good news is the symptoms have been shown to actually be less in older patients than they are in younger patients. So that's good for our residents here. So local reactions, that means pain, flushing, fever, etc. Pain after the first dose, any pain whatsoever, 71% of people got some pain after the first dose. 0.2% of people got severe pain. Now, pain was the only reaction that actually decreased with the second shot. The rest of these systemic reactions increase with the second shot, so anticipate a little more potentially. Fever greater than 100.4 degrees Fahrenheit. 1% of people after the first dose got that. After the second dose, fever of greater than 100.4, about 10 to 11% of people got that. Headache. Any headache, 25% of people got it after the first dose. Fatigue. Any fatigue, 34% of people after the first dose. Severe fatigue, 0.1% of people. People with allergies will likely have a little more local effects. Redness, swelling, maybe some pain, maybe a little extra elevation in temperature, but allergies to other things does not preclude getting this vaccination. What can you tell us about the safety of the vaccine for women of childbearing age, pregnant women, and breastfeeding women? I do have to say I didn't know so many Clark residents were either of childbearing age, pregnant, or breastfeeding, but I think it's a good question. Unfortunately, there is no data on this. This is the most challenging one because they excluded this group of women from the studies. So anybody who is either breastfeeding, pregnant, needs to consult with their own physician and make an informed decision with them. Side effects tended to resolve within 1 day. So within 1 or 2 or maybe 3 days, the effects of this vaccination should wear off. Encourage you strongly to get it. Thank you very much. And Clark is doing a wonderful job and will continue to do so.